So another pertinent question that we face a lot of times from the patients that visit us or call us or seek our consultation is whether is there an absolute indication of having to undergo orthodontics when we are undergoing jaw surgery. So patient we know is a severe case, requires jaw surgery, is willing to undergo jaw surgery, but a lot of times has some restrictions or in terms of the length of the orthodontic treatment, because we know that the patient has to undergo orthodontics once he's strapped up for a good 8 months, at least for 8 months to 1 year. So is there a possibility of correcting jaw deformity with only surgery without doing orthodontics?
Thank you, Dr. Jugal, for this question, because this is like a very common question patient ask. Can we treat our facial deformity without any kind of a braces? As you mentioned, braces treatment is definitely requires some timeline to treat this thing, but historically it's a deformity of face or jawbones. So it not only is a problem of the bones, it is also a problem with the teeth. Okay, so most of the time whenever there is a deformity, the teeth are trying to get compensated, like they are trying to get adjusted to each other in that abnormal position. So basically whenever we do jaw surgery, it is usually a combined approach, surgery along with the orthodontics. So except few very limited cases, usually it's not a good idea to avoid orthodontics and doing only surgery, because post surgery there is a change in their bite and the teeth may not be in a proper relation with each other, and in a long run same when we try to compensate and what consequences come here as well. When the bite is not stable, patient will have some problems like difficulty in chewing, they might have some TMJ problem, their dental their teeth also will have a problem in a long run, like a periodontal issue and all these things. So in most of the cases, I would say more than 90% cases, it's usually a combined approach where we need orthodontics along with the surgery. But some exclusive cases where the teeth alignment is proper, where the bite is properly settled, like a case of where there is a obstructive sleep apnea, or a case where there is a facial asymmetry, but that their bite is very well settled, probably we can avoid orthodontics and we can do surgery by keeping the same bite. And for that we definitely need virtual surgical planning. We need to focus more on good planning, so that by keeping the same occlusion we can treat the facial deformity. But in general, do not try to take any shortcut. You need to understand that along with the surgery, orthodontics is also equally important. So most of the cases it's a combined approach.
Right. So again, a short message if you have to take is like how surgeons are dependent on orthodontics. Orthodontics is dependent on surgery and vice versa. So what we have to basically remember is, for most of the cases, a joint consultation between an orthodontist and a surgeon is mandatory.